The chair will now recognize the gentleman in celebration of his birthday, the gentleman from Georgia, Mr. Carter.
Thank you, Mr. Chairman. I appreciate you sharing that with everyone. And I do appreciate it very much.
We didn't ask what year.
Yeah, thank you for that as well. Yeah. Well, thank all of you for being here. Full disclosure, I am currently the only pharmacist serving in Congress. Not only am I a pharmacist, but I was also a consultant pharmacist, and my expertise and my career was spent in institutional pharmacy and in nursing homes. I've gone through federal inspections, state inspections, so this is something that I'm very familiar with. And I have to tell you, I was blessed to be in a number of good nursing homes that provided quality care, that really cared about the patients. And sometimes I could get frustrated by some of the regulations. And I just want to encourage you a couple of things. First of all, you know, it is important. It is important to have a registered nurse 8 hours a day. It is important to make sure that rules and regulations are followed, but sometimes we get caught up in the cookie cutter approach and that one size fits all. And I just want to encourage you, and I say that because I've seen it firsthand. I've seen how nursing homes struggle, and they struggle to find good quality help. They don't pay very high. They can't afford to. It's difficult at times. That's no excuse. You still have to have quality care, and as I say, I was very blessed to be in facilities that provided quality care. I think that I'm sorry I had another hearing, but we've already talked about the payroll-based journal and about the fact that salaried employees, and trust me, I have seen a salaried DNS who has, you know, is registered as 40 hours, seen them work 60 or 80 hours a week. So that's a kind of a misnomer, and I hope you take that in consideration. And then whenever, you know, you're talking about a 30-minute lunch break, I've seen them, you know, take 5 minutes to cram something down their mouth and go on and continue on. I've also seen it, as you well know, and I know I'm the preacher preaching the choir here, but nursing homes can fall apart quickly. I've been in a nursing home in the morning, and it was, you know, in top shape, and then by the afternoon, and just because of the patient population, it can really fall apart very quickly. But anyway, having said that, I will tell you that I am concerned, particularly the federal inspectors as it relates to the state inspectors. I've seen the state inspectors sometimes try to do too much because the federal inspectors are following them. Generally what happens is that you would always know if the fire inspector came, then probably the state surveyors were coming next, because the fire inspector would always come first, and then the state surveyors would come. And the federal surveyors would come after the state surveyors in order to see how well the state surveyors had done. And sometimes I felt like they were putting undue pressure on some of the state inspectors. Not that they didn't need it at times, they did, and it is important. It is important to have the checks and balances in that, and I understand that. I wanted to ask you, and I'll ask Dr. Goodrich you this question about some of the potential complexity for providers that the regulations. As I understand it, there's been a temporary moratorium placed on some of the 194 regulations as a result of the stakeholder feedback. Just to clarify, how many of the 194 regulations had this moratorium placed on them?
8.
8 of them? And out of those 8, do you have, did any of those have to do with neglect or with abuse?
They did not.
They did not. Okay. Good. They should not, and I appreciate that. And finally, do facilities still have to enforce these 8 regulations and have a plan in place to fix them if they're non-compliant?
Absolutely. That's our expectation, yes.
That is your expectation. Good. Again, you know, I've seen the burden that can be placed on these facilities, and again, no one's accepting, and I'm certainly not advocating that they shouldn't have quality care. This is a very feeble, if you will, population that needs this help. But I just want to make sure we've got balance here. I want you to understand that I've worked side by side with these people in the nursing homes, and they are good people who truly for the most part. Now, like every profession, you got bad actors, and you have to get rid of those bad actors, and to a certain extent, to a large extent, that's your responsibility, and it's responsibility of the state surveyors. We need to get those bad actors out. They need to be brought to justice, if you will. But for the most part, I just feel like I need to express to you the true quality work that many of these facilities provide and that many of these employees provide. And Mr. Chairman, I'll yield.